Congressman John Larson joining us from the House. This really is a House-Senate effort, and I feel is an effort that could both be implemented right away after passed and is something that has broad support and a lot of enthusiasm in the country, that's for sure. We are introducing, as we indicated, legislation today to give people who are age 50 up to age 64 the option, the choice to be able to buy into Medicare. And we look at this as focusing on three important areas and goals. One, of course, to lower people's costs, and we know that this can do that. To reinforce the existing Medicare program and to strengthen the health insurance marketplace as well. People aged 50 to 64 are the group most likely to see cost increases and lack of affordable coverage. The per-person out-of-pocket health care spending for people aged 50 to 64 is more than twice that of younger people. A University of Michigan study found that 27% of adults aged 50 to 64 are not confident they can afford health insurance over the next year. And 13% did not get needed care because of the cost. Nearly 1 out of 4 kept a job, considered delaying retirement, or delayed retirement to keep their employer-sponsored health insurance. So this provides an option. And in a state where we see people that are being told they can either take early retirement or lose a job in a number of industries, this goes right to that group of people that have the most concern and anxiety about whether they're going to have affordable health care. One of the things we also know, and I, in fact, just met with a group of doctors talking to me about the number of people that are putting off tests or treatments, waiting to get to age 65 in order to be able to be covered by Medicare. So we know from economists that we actually can save dollars in the overall system as well as in the ACA marketplace when people can get the treatments that they need, and in the marketplace it is stronger with younger and healthier people. So many folks have said to me they're holding their breath until they get to age 65. I want people to stop having to hold their breath and to be able to get the affordable health care they need. And it's time to pass this legislation to make that happen. Senator Tammy Baldwin.
Thank you, Debbie. Well, I am so grateful to the leadership of my colleague, Senator Debbie Stabenow, as well as Senator Sherrod Brown in joining together to introduce this legislation, and certainly happy to have a reunion with 3 former colleagues in the House, Congressman Brian Higgins, Joe Courtney, and John Larson. Healthcare costs are too high. And many Americans still can't find the health care they need at a price that they can afford. Last year, Wisconsinites sent a really clear message to Washington that they want us to work together and they want us to expand access to health care and to lower costs. And so I'm proud to join my colleagues today in introducing the Medicare at 50 Act. Our legislation will give millions of older Americans another choice for more affordable, quality insurance coverage. For people between the ages of 50 and 64, this is another high-quality option where they can find a health care plan that meets their needs. By giving more Americans the option of buying into Medicare earlier, we can increase competition in the healthcare insurance marketplace and help reduce healthcare costs for millions of Americans. Medicare at 50 is a very bold step in the right direction of reducing costs for older Americans who have some of the highest healthcare costs to begin with. I've always supported universal health care, but we are not there yet. So let's continue working to guarantee high-quality, affordable health care coverage for every American. You know, it is a goal worth reaching, and as Americans, we should never let anyone tell us that we can't reach it. Thanks again, Debbie.
So
and I want to welcome to the podium Representative Brian Higgins.
Thank you, and thank
Oh,
you.
and we've been joined by Peter Welch.
Yes, Peter, glad to have you. Thank you so much for your partnership.
Thank you. Thank
Yes.
you very much. Thank you, Senator Stabenow and Senator Baldwin, John Larson, Joe Courtney, and Peter Welch, who have been fully engaged in the development of this bill over the past year, not only with their senior staffs, but they themselves, just underscoring the profound commitment to this bill. Let me put this in historical perspective. All of us proudly supported the Affordable Care Act 10 years ago. We supported it knowing that it was flawed in many respects. Even the President Obama, had said that. And we had an obligation to the American people to use it as a basis from which to improve on the Affordable Care Act. So the Affordable Care Act was a start, not a finish, and a significant start because Republicans and Democrats over a 100-year period tried to do health care reform in America, and it was because of the Affordable Care Act that it started. This is the first major improvement to the Affordable Care Act. People in the age demographic 50 to 64 and a half, of which there are 60 million people, need the protection of Medicare now. Medicare has always covered pre-existing conditions. And I think most people that supported the Affordable Care Act will say that the one fundamental flaw that there was, not because of fact, but because of politics, was the lack of a public option. Medicare is the best public option that already exists. Medicare meets with high satisfaction ratings amongst its beneficiaries at over 90%. Nearly every Medicare beneficiary, of which there are 58 million in America, has access to both a primary care physician and a physician specialist. It's a great brand. The money in Medicare goes to health care. It doesn't go to pay high salaries. The chief executive officer of United Health last year made $18 million. The head of Medicare made about $250,000. So there's a lot of money in the healthcare system, about $2.5 trillion, 18% of the American economy. What we're concerned about up here is that that money go for the right purpose, to give people affordable premiums, to give people high-quality care, and to make sure that the providers are properly compensated. It is a very, very good bill that could be enacted now at no impact to the federal budget because the cost would be borne by those who choose to exercise Medicare at 50 as a health care option on the exchanges. Another historical perspective. We're showing that as compared to a gold plan on the marketplace, on the exchanges, if somebody opts into Medicare at 50, they will save 40% on their premiums before there are any subsidies. So this is an age demographic, as I said, that gets knocked around pretty good by private insurance. Why? Because their utilization is higher. Their problems don't start when they already pay too much for health care. Their problems start when they need the health care that they pay too much for. And this bill, Medicare at 50, will provide immediate relief to an age demographic that desperately needs it. So, Senator Baldwin, Senator Stabenow, thank you so much for your leadership on this issue. And with that, Representative Joe Courtney.
Great.
Yes,
Well, thank you,
right.
Brian. And again, Senator, thank you to both Tammy and Senator Stabenow for hosting this here today. And again, I just want to sort of foot stomp the point that last November, if you look at an historic election in terms of both turnout, obviously changing control of the House of Representatives, healthcare was still the number one driving force that, exit polls, pre-voting polls showed over and over again. Number one, that the push and the drive to repeal the Affordable Care Act obviously was a complete loser with the American public. People did want us to protect protections for pre-existing conditions and all of the architecture that was built around it in terms of essential health benefits, lifetime caps, elimination, et cetera. On the other hand, there also was a very strong message that the costs that people were still struggling with needed to be addressed and dealt with. And this legislation, which is framed in a way that does not mandate any changes in terms of people's coverage, does not try and reinvent the wheel with a new program, is a common sense, workable, and feasible way to respond to that demand that the voters definitely sent a message loud and clear. As Brian said, if you pay for Medicare without any other assistance, you're already looking at dramatic savings in terms of what exists out there for that 50 to 64 marketplace. Again, in the Affordable Care Act, we eliminated partially age rating, but we still left adjusted age rating so that there is still a 3-to-1 ratio between premiums that are charged to people over age 50 versus younger Americans. So that explains exactly why this Medicare at 50, Jim, fits in perfectly in terms of, the group that is really struggling the most in terms of high premium costs and high out-of-pocket costs. The bill also is still integrated with the Affordable Care Act so that if somebody above the age of 50 actually qualifies for an Affordable Care Act subsidy, that can be applied towards the premium, which will make the savings and the benefit even more dramatic. And again, the deductibles that exist in the Medicare program, again, are far more attractive than some of the gold plans, silver plans, bronze plans that are out there right now. And lastly, I would just say that this is something that is not pie in the sky. This is not aspirational. This is a piece of legislation that you can turn on the switch overnight. There is no new administrative gymnastics that are required in terms of creating a new benefit package. It is, as Brian said, the most trusted health insurance in America today. And again, it just really requires the political will to create this new option for millions of Americans that, again, will improve and take America's healthcare system to a new and higher level, and is completely compatible, by the way, with almost any other plans that are out there. The benefit of ours, though, is it can happen immediately. And for that reason, we should vote on it immediately. So again, thank you for, and I'll now yield to my friend from Connecticut on the Ways and Means Committee, which has the Medicare cognizance, John Larson. Yeah.
Thank you very much, Joe, and thank you, Senator Stabenow and Senator Baldwin, and to be here with my colleagues, and especially Brian Higgins, who has taken the lead on this, along with Joe Courtney and Peter Welsh. And Joe's correct on the Ways and Means Committee. Things have changed dramatically also. We're actually, Senator, going to be able to have a public hearing on the subject instead of behind closed doors negotiations that never come to fruition. This is a common sense solution. As someone who has somewhat of an insurance background, I can tell you that it's important on so many levels. Number one, it's revenue neutral, as you've heard. Number two, it's going to give so many people, and how many stories, and Senator, you were alluding to this, do you hear from people who are in their late 50s and early 60s, and the employer and the green shades are looking at the cost of insurance, and those are the people that maybe are let go early, or those are the ones that are going to have a difficult time finding insurance. Well, if there was an option out there for them to buy into a plan that, as Joe said, is a turnkey operation, doesn't that make all the sense in the world? And won't that help in terms of lowering costs? Imagine 50-year-olds to 64-and-a-half-year-olds. That also does something for the Medicare population in general. It makes it younger. And in a dramatic way, for people, assuming you can stay on your parents' policy to age 26, from 27 to 49, it makes a dramatic impact in terms of what their cost of insurance would be. They will no longer be in the same group as 50 to 64-and-a-half-year-olds. So we look at this as an economic plus a common sense way of moving forward that makes all the sense in the world. And also what this bill does is allow for the direct negotiation on the part of Medicare to lower prescription drugs. On average, we know that this is a 24% decrease. So all the way around, we are enthusiastic about this. And with Brian Higgins' leadership in the House and Senator Stabenow in the Senate, we know that we're going to have the hearings that will lead to its passage. And with that, let me introduce Peter Welsh.
Hey, hi.
Is there anything more to be said
Just say, hey.
after Mr. Larson? We have a dream in this country, and that is that everybody have access to health care, regardless of their age, regardless of their situation, regardless of their employment status. And we'll never achieve that dream unless it is affordable. And as Joe Courtney said, the big issue for Americans is not just access, it's cost. And by the way, that is not an issue just for individuals who are suffering with high premiums and co-pays and deductibles. It's for our employers. You know, we've got an employment-based system that a lot of people depend on. This would accommodate that. And that is what makes so much sense about this. We've got a Medicare program that people trust. They trust it because it's affordable. They have access to the care that they need. They make their decisions about their own health care, and you don't have government really getting in the middle of that. And this opportunity allows us to make enormous progress by taking advantage of what we have, what people trust, and what works. And it also is at the heart of what we need to do in order to bring down cost. And John Larson just mentioned we're negotiating prescription drug prices under this. Well, why not? We're the only country where the government doesn't play a role to protect consumers and employers who pay premiums from price gouging. And now what we can do with this legislation, and I certainly hope we can get our Republican colleagues to join on this, is take advantage of the good things that are out there in the healthcare system, make them more affordable to everyone and more accessible to the people who will now be able to participate in the Medicare program starting at age 50. Thank you, Senator
Thank you so
Stabenow.
much.
And
Thank
Brian
you.
Higgins, what a great job.
Well, thank you.
He's going to give a reputation of Democrats being sensible.
We are. Well, as you can tell, we are very enthused about this. As my colleague said, this is something that we are putting forth in a very enthusiastic way in the House and the Senate. It could happen now if it passed using the current system, a trusted system with those individuals, those citizens who are most struggling right now in terms of healthcare costs. And so we're going to keep pushing until we get this done, and we'd be happy to answer questions. Yes?
This is probably more for Mr. Larson or anyone.
Sure.
Why, how, can you give me the path for this coming up? I understand, is this, I see what you said, is going to get hearings. Where do you expect hearings to occur in the House?
Well, in the House, there are multiple committees of jurisdiction. I serve on the House Ways and Means Committee, as does John Larson. So we anticipate, and I have had discussions with the Speaker about having this bill taken up in some way in the 116th Congress.
And I should mention, well, not being in the majority, and I wish we were, I am the ranking member on the Health Subcommittee of Finance. And we will be pushing very hard to have this included as part of a hearing when we're looking at the healthcare system. Yes?
Any conversations with the CMS director or administrators about their reaction to this?
I have not yet. My staff has certainly been working from a technical standpoint. I've not yet talked to the CMS director. I'm going to be seeing the secretary shortly and have an opportunity to talk with him about this. The folks I have been talking to have been doctors and hospitals and many people who are extremely enthused about the role that this can play in bringing costs down and providing comprehensive care. And I would finally say, and then turn it over to my House colleagues, that in an age when we are seeing this administration trying to, and in fact undermining comprehensive coverage by putting more and more junk plans out in the marketplace that don't cover essential services and are getting closer and closer to not covering pre-existing conditions. We know that Medicare covers pre-existing conditions and is comprehensive. And that also gives peace of mind to people who are in most need of those comprehensive services.
First of all, I would say that part of this, I think, is Congress reasserting itself. That it's Congress that makes laws. It's Congress that makes budgets. The CMS director will participate, but Congress has to send a clear message that we are prepared to authorize the Secretary of Health and Human Services to design a program to allow people to buy Medicare. But just keep in mind as well that age demographic 50 to 64 and a half, 40% of whom have pre-existing conditions. Kevin McCarthy's comments were reported today in the Washington Post. He had said that they lost the majority in the House because of pre-existing conditions. Keep in mind there is one federal law that protects people with pre-existing conditions, and it's called the Affordable Care Act. And if you voted to repeal that 70 times, 7-0, you obviously do not support protecting people with pre-existing conditions. Pre-existing conditions are people that are, in many cases, genetically predisposed because of a genetic mutation for diseases like cancer, like heart disease, like diabetes. These people should not suffer. So on the merits, this makes a lot of sense, and on the politics, obviously the American people are watching.
Yeah, the only other point, if you look at the Affordable Care Act and Medicare, how they sort of interact, I mean, we actually there's language in the law that basically states very clearly that Medicare is a qualified plan for the purposes of benefits in the Affordable Care Act, which again means that administratively there really is just no legal barriers as far as setting up subsidies through the exchanges, that Medicare could be offered as an option. So I haven't talked to CMS, but as I said, we have scrubbed both laws just to make sure that we're not missing something in terms of legal hurdles, and really there are none.
Mm-hmm. As a follow-up to that, though, on legal hurdles, what about people that get TRICARE at this age?
Again, this is an optional plan, so nobody is getting moved automatically from one plan to another. The TRICARE for Life, which is for over 65, I'm on armed services, again, is for that specific population. Our bill doesn't, touch that. Absolutely. Again, if people want to elect to use Medicare 50 and up, there is no barrier that TRICARE would create.
This really is about having another choice for people, and it also will tell us how many people choose that choice, because there's a lot of debate around Medicare and how to expand or whether or not to expand Medicare. Giving people a choice, I think, is very, very important. And it's set up with a separate pool for those in this age group. People pay premiums. If they qualify, they will have the same tax credits and cost share as others. And basically, if they wish to, then they would have this opportunity. Yes?
Hi. I just had a follow-up on Alex's question for Congressman Higgins.
Sure.
Do you anticipate a floor vote on this Congress, or do you have any commitments from Speaker Pelosi?
The commitment of the Speaker was to make a good faith effort to deal with this in the 116th Congress. And as has been said by the Senator and Joe Courtney and others, this can be done immediately. There's not, keep in mind when the Affordable Care Act was enacted, it took 5 years to fully implement. This is something that could be done immediately because, as has been clearly said, this is a public option that already exists that would be available to people that choose to take it and pay for it in full. So we're really not talking about designing a whole new program. We're just talking about extending the great Medicare that is time-tested over 50 years, health insurance program available to anyone between the ages of 50 and 64 and a half that want to purchase it.
So is that kind of an argument against just going straight to single payer?
It isn't. I think, I think that's a false narrative. I think, first of all, the Henry J. Kaiser Family Foundation has tested a lot of these variations of Medicare for All, Medicare for More, call it what you will. The 77% of Americans favor this bill, favor this concept. It's the highest percentage of public favorability for any of these options. I think it is good in and of itself because it would provide the protection of Medicare now, and it could be a pathway to something greater. But I think the most important thing to keep in mind is the Affordable Care Act has not been improved upon since its inception. This is the next iteration, the next improvement of the Affordable Care Act. And as Joe said, the Affordable Care Act, and the Senator said, and the essential benefits, that is the law of the land. Every insurance policy has to comply with that. So, this is ready to go.
And I would just underscore and add to Congressman Higgins that when we look as Democrats, one of the things I'm so proud of in the House and Senate is that every proposal that has been talked about or introduced increases health care and lowers costs. Every Democratic proposal increases health care, lowers costs. Unfortunately, every Republican proposal that's come forward takes away health care and increases costs. So that's the real bottom line here. There's a big difference in how we view the importance of health care. Yes, sir.
So to build on that, is it fair to say that you view this as a necessary step if the Democrats' goal more broadly is universal health care, single payer at some point?
Well, again, I support this in and of itself as an important place to be, while there's a debate about larger structures and so on and whether we should be moving forward. There's no question that for those who are supporting Medicare for All, there would have to be major phase-ins and other kinds of issues that would have to be addressed. This is very straightforward. It addresses those right now who even under the Affordable Care Act can be charged 3 times more than somebody younger, and they use more medical care and are more likely to be in a situation where they lose employer care and are waiting to age 65. So this makes sense in and of itself. We have some colleagues that are supporting this as a step, others who are saying, I think this is what we ought to do and have the private marketplace addressing those that are between age 27 and 49. So there's differences of opinion. The great news is this can be done now and has broad support. Thank you very much, everybody. I'm sorry, did you want to follow up on that? And then we'll take that as a last. Yes.
Thank you. So doctors and hospitals, a lot of them already complain that Medicare doesn't reimburse cost. And if you expanded the Medicare population in this way, would you have to look at raising Medicare reimbursement rates?
Well, I would say as somebody who works a lot with doctors on rates and led the effort to get away with what was called the SGR for years, and 18 years of my life was spent trying to get rid of that. I want to make sure that whether it's age 65 and older or under, that Medicare is reimbursing as it should be reimbursing. Same with Medicaid, which is even less. So that is an issue that we need to make sure our healthcare professionals are receiving the reimbursement that they have. To me, that is separate from what we need to do to expand access, but very important, and I don't shy away from advocating for our doctors and other healthcare professionals. Thanks, everybody. I'm sorry. I didn't mean to keep
very quickly. The only thing that Medicare is more popular with than the beneficiaries, it's about 90% across every political party, is with doctors and physicians. 98% of Medicare beneficiaries have access to both. Reimbursement rates will always be an issue. Docs and hospitals like Medicare. Why? Because they're a reliable payer. And there's always going to be that tension between is it enough or not enough. They all take it, which is evidence of the fact that while they complain about it, they're pretty happy with it.
Yeah. So, great. Thank you very much, everybody.
Thank you very much. Wonderful.
I'm looking forward to working. I know we've had a talk to a couple of Michigan people about
Thank you.